SAFE is very proud to be talking today with a person who has a unique perspective on stroke and stroke prevention, Dr. Hrvoje Jurlina from Croatia. Could you please tell us more about yourself?
Thank you, Elena. I'm very happy to be here today. My name is Hrvoje Jurlina. I was born and raised in Vancouver, Canada. I live in Croatia at the moment. I'm a GP, family doctor. Had a stroke 4.5 years ago, and my father died of a stroke half a year ago.
This is very, as I said, unique perspective. We were talking about stroke prevention, and this is the main topic of our website, strokeprevention.info. Could you tell us more about risk factors, actually about this controversy or problem that even when we know stroke risk factors, it's very difficult to actually prevent stroke. Why is it happening, and what's your take on this?
Good question. Regarding why strokes happen, even though we know the main stroke factors, comes down to a social economic situation of the individual or the community. For example, in Croatia, one of the poorer members of the European Union, it's pretty much tied into a force of habit. If we know that what you eat is what you are, and we know that, for example, healthy food is more expensive than less healthy food, then we have a situation where people, because of the economic situation, are eating less quality food or avoiding the healthy food that they're supposed to be eating. And by doing so, they're raising their blood pressure, increasing the chances of diabetes or having uncontrolled diabetes. The level of lipids in their blood are skyrocketing, and so on and so forth. The way of life has become very modern, which means that it's very much go, 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 which means that you don't have the time to eat properly, and most people don't have the time to do any sort of physical activity outside of their own work. So it becomes a social economic problem in the sense that you cannot enforce someone to eat properly and to exercise if they can't afford it or they don't have the time to do it.
Well, quite a challenge. But what about your personal case? What was your opinion on stroke prevention? Did you think about it at all, about these things that you're now mentioning before your stroke, and how this changed after you experienced it?
Well, my stroke was, let's say, outside of the norm. I was 39 years old. I work as a medical doctor. I didn't have high blood pressure. I didn't have high levels of lipids in my blood. I didn't have diabetes. I regularly exercise and stuff like that. But the main problem with me was the stress level. When you see, as a GP, 90 people a day walking through your family practice, and you're trying to solve 90 different problems in 90 different situations, it raises your stress level. And it got to the point where it was occupying my entire life. And being the individual I am, I try to solve everybody's problem. Looking back on the situation now, and after discussing it with colleagues, we came to the conclusion that I had to lower my stress level. Before my stroke, if someone had said I was going to have a stroke, I would have bet everything that they were wrong, everything, which goes to prove that most people do not see it coming. Stroke is something that happens, and it happens in a surprise way, and nobody's ever prepared to suffer from stroke.
So, in short, you didn't think about prevention until it hit you?
Regarding myself, no. Even though I was giving the advice that I should have took for myself to my patients, but that's a typical doctor thing to do.
Is it true that doctors are the worst patients?
Absolutely. We're just awful patients.
Okay, but this is only one of your many perspectives on stroke. So you are a stroke survivor, and you are also a medic, and you advise patients what to do with their health and how to preserve their health, how to stop stroke from happening in the first place. And you also have this third very sad perspective of a family loss, quite recent family loss due to stroke. How did this affect your way of thinking about stroke and stroke prevention?
Well, I look at it as if I have a three-dimensional way of looking at stroke now. Like you said, I'm a family doctor, so medically speaking, I know what you're supposed to do and what you're supposed to avoid in order not to have a stroke. And once you have a stroke, I can tell you what you're supposed to do and how you're supposed to deal with it and so on and so forth. But saying one thing is completely different than actually doing it. We live in a society where it's all neatly written on paper what your rights are and what you're supposed to be doing and how it's supposed to be done. But when you actually get out on the field and try to get it done, you realize that it's almost close to impossible. My second perspective would be my own stroke, where I was the patient lying in the bed. And my third perspective was the role of lead caregiver for my father. Even though I had a stroke, 3 years after that, when my father had a stroke, I realized that I knew nothing about post-stroke care because I walked out of my stroke without any major difficulties, while my father was pretty much bedridden for the entire 10 months of his last 10 months of his life. And when you have someone in that situation, it's the way I describe it is if you have a child, if most people have children, it's like having a child that is 80 to 100 kilos, and you have to do everything that you would do with a child with that person. So you're changing him, you're washing him, you're taking care of his wounds, you're making sure he's getting his medications and stuff like that. And there's always the question of whether or not he understands who you are, whether he understands what you're telling him that you're going to do, whether he hears you, whether he sees you, because he can't communicate, you're just hoping that everything else functions. It got to the point where he was doing something funny with his mouth. I remember that, and I was wondering whether or not he had a toothache. And there's no way that he can tell you that, hey, my tooth hurts. And we all know how bad toothaches hurt. So when you have that kind of perspective, you realize it's not just about giving advice how to avoid strokes. It's not just about surviving the acute phase in the hospital and everything's going to be okay afterwards. You realize that it's a path that has a beginning and it has an end. And it all depends on what kind of care you give or receive, where that end's going to be, whether it's going to be within 10 months, whether it's going to be in 20 years, and so on, and what kind of path is it going to be. Is it going to be a rough path, smooth path, a happy path, and so on and so forth.
We are covering 10 risk factors on this website. What risk factor would you single out from this group, and can you tell us why?
Well, most of the risk factors can be annihilated or at least brought to a minimum if people, the general public, would consider eating healthier, avoiding overeating, exercising, and so on and so forth. I'm talking about high blood pressure, diabetes, and lipids in the blood, and so on and so forth. But when you look at, there's certain risk factors that we find accidentally, let's say in the family practice. For example, atrial fibrillation. It's not something that all patients feel. For example, in my own practice, I have at least 30 to 50 people in the last 10 years that I've accidentally discovered atrial fibrillation. It's something that should be regularly checked up on once every year or once every 2 years, especially someone over the age of 30. Most people, once you find it and you start asking them certain symptoms that are involved around atrial fibrillations, they then recognize that, yes, they've had these symptoms, but they just figured it was normal because they are not educated to the sense that they feel that, when your heart skips a beat or regularly skips a beat, they don't realize that it's not normal. That's not what's happening with everybody else. And atrial fibrillation is something that can be controlled completely. It's not expensive. There's a little bit of legwork revolved around it regarding blood work and stuff like that. But it's something that can be controlled. So it's another risk factor that, if found out on time, can definitely be taken off the list, let's say.
Thank you very much for this conversation today, and we hope to hear more from you and from your national experience in Croatia. This was a short talk about a unique perspective from 3 different angles on stroke prevention with Dr. Hrvoje Jurlina from Croatia. Thank you.
Thank you very much.